Hafaday. Hi everyone, my name is Pete Flores. I am from Guam Communication Network, GCN. And thank you so much for agreeing to be in our study about Pap testing among Pacific Islander women. This study is a collaboration between Guam Communication Network, Tongan Community Service Center, Samoan National Nurses Association, Orange County Asian Pacific Islander Community Alliance, and the California State University of Fullerton. Okay, cervical cancer. Now we will begin our education portion with this workshop. We will be talking about preventing cervical cancer among Pacific Islander women. Why are we talking about this with men? Because they play an important role in preventing this problem. Women are an important part of our life. Do you agree that our wives helps us in many ways? In our Pacific Islander community, it is important that we keep our women healthy for not just only themselves, but for the health of their immediate family and the health of their larger families and communities. All thought God take care of us all. He has always given us tools to care of ourselves and our family. As men, it is our job to keep our women healthy in order to keep our family healthy. We can also think about this in a different way. As men, we know that we can do this on our own, but doesn't having a wife help makes it easier for you? Think about it. How different would your life be without your wife? Okay, now let's talk about important health problems that affect our women. That problem is called cervical cancer. First, let's go over some basic facts about cervical cancer. Here's the truth about cervical cancer. Cervical cancer is not a death sentence. It is one of the few cancers that are prevented with an easy test. Married and single women alike can get cervical cancer. It affects all women. Getting cervical cancer has nothing to do with having poor hygiene. It happens because of a virus. Now you know a little bit about cervical cancer. Let's talk about how it affects Pacific Islander women. To show how cervical cancer impacts Pacific Islander women, who do you think is more likely to get cervical cancer, a white woman or a Pacific Islander woman? For instance, who do you usually hear in the news about? You think a white woman is most likely to get cancer, right? Well, guess what? Pacific Islander women are most likely to get and die from cervical cancer than white women. For instance, the number of new cases of cervical cancer was 9 times higher for the Chamorro women than the U.S. women. And the Samoan women are 2.5 times more likely to be diagnosed with cervical cancer than the white women in Los Angeles. This could be due to many reasons such as lack of insurance and getting a test, personal embarrassment, or other beliefs. But all Pacific Islander women in Southern California took steps to prevent cervical cancer. We could save the life of 3 to 5 women a year. And remember, since each woman has family who counts on her, that means that we can help improve the life of hundreds or even thousands of Pacific Islander in our communities. So, are you ready to learn how we can save women's life? Okay, to show how to prevent cervical cancer, all women are at risk for cervical cancer, but certain factors increases the risk of developing a disease. Here are the things that you need to know to help prevent cervical cancer in our wife. Number 1, 99% of cervical cancer is caused by a virus called human papillomas or HPV. HPV infection is very common, and most people do not know they have HPV because there are no symptoms. So having your wife get tested for HPV. Number 2, HPV is a common virus that could pass from one person to another during sex. So be faithful to your wife or partner. There is a higher risk of contacting HPV if one starts having sex at an early year. or if you or your partner had sex with several other partners. Number 3, help your wife to not smoke. Smoking increases the risk of cervical cancer and many other cancers. Number 4, how is your wife or family health histories? The more you know about your family's health history, the better you can screen disease she could be prone to. And the most important way to help prevent cervical cancer is helping her to get a Pap test. A Pap test is a simple test done in a doctor's office that can find early signs of cervical cancer problems before they become cancer. With the result of Pap tests, the doctor can also remove the problem, thereby preventing cancer completely. 6 out of 10 cases of cervical cancer causes occur in women who had never had a Pap test and had not tested in the past 5 years. Would you be willing to help your wife or partner get this simple test in order to prevent cervical cancer? Good. Then let's talk about when your wife or partner should be getting a Pap test. Your wife or partner is getting a similar education presentation about Pap tests that explains in detail what the test and when she should get it. Since some of this information is personal to women, we will not be reviewing it in detail with you. But in general, if women feel specific pelvis pain, she should get a Pap test. So ask your wife or partner about any symptoms she may be feeling and remind her that she should get a Pap test immediately if she has a constant pelvis pain. When should your wife or partner get a Pap test? Get a Pap test even if she has no symptoms. It is like tuning your car. Get a Pap test can help prevent cancer by finding problems before they occur. However, most women who have cervical cancer feel no symptoms at all. So make sure that she get tested even if she has no symptoms at all. Like I mentioned before, Pap test finds problems before the problem turns into a cancer. How often should she get Pap tests? Now that we know that our wife needs to have a Pap test whenever or not that they feel sick, how often should she get a Pap test? After the age of 21, she should get a Pap test every 3 years. Age 30, tests every 5 years if previous tests were normal. Age 65, talk with your doctor about how often to get tested. But the bottom line is that many of our Pacific Islander women have not had a Pap test or to get. Women still needs regular Pap testing even if she had the HPV vaccine. She reaches menopause, she stopped having children, or she is not sexually active. I know that talking about women's health issue with our wife is not easy or comfortable, but it's important in order to reach the goal of keeping our women's healthy. And think of this way, you are a head coach of a team. Isn't your job to help make the plays, to move the ball to the goal line and score? This is the same as being the head coach for your family. Only now, your job is to coach your wife to get regular Pap tests so that she can stay healthy. And don't wait till the last minute to do your job. If you wait till the last minute, you could lose the whole game or lose your wife. What are some other ways to help coach her to get a Pap test? Here are some things you can help her with. In her educational workshop, she got a list of clinics. Reveal it with her of low cost or no cost clinic in your area. Help her find a female or Pacific Islander doctor on the list if she prefers. Tell her that you have your support in this matter, or even drive her to the exam. The Pap test only takes 15 minutes, or even watch the children if she prefers to go by herself. Assure that caring for one another is nothing to be embarrassed about. Bottom line is that I want you to help your wife or partner get a Pap test for the health of her and her family. Let's summarize the 3 main points from this workshop. You can prevent cervical cancer by asking your wife to get a regular Pap test. She needs your support in getting regular Pap tests to care for your family. Help her get a Pap test as soon as possible. In order to help you support your wife, I have assigned for you here is a postcard. Please write your wife's name and address and a brief note reminding her to get a Pap test. Thank you again for joining us on this presentation today.